We will look at how drugs affect the growth and development of the fetus. A fetus is connected to the mother system by the placenta. Through this connection, the fetus receives nutrients, metabolic wastes, as well as toxins from the mother. If a mother uses a substance, the fetus can be affected by it through this connection. A fetus goes through many stages of development. Along each stage, there are certain points of vulnerability. A substance that the mother takes can affect, hinder, or retard certain growth and development at each stage. Today we will talk about how a mother's use of alcohol, cocaine, nicotine, cannabis, and methamphetamine can affect the fetus's growth and development. Alcohol use during pregnancy. Fetal alcohol syndrome can develop as a result of a mother's use of alcohol while she is pregnant. It is a long-term condition. It is the most common cause of mental retardation. Those born with this condition lack certain left and right brain connections. Dysmorphic facial features, which we will see on the next slide, are the most noticeable indicator of this condition. There are an average of about 19.5 per 10,000 babies born with this condition. Hemangiomas, which are benign tumors that can appear on a child, as well as microcephaly, are common results of fetal alcohol syndrome. So smaller head than normal. Here you see the fully developed normal head size for a child that age. And here we see the small eye openings, smooth philtrum, thin upper lip that are the dysmorphic facial features commonly associated with fetal alcohol syndrome. So 1 to 2 ounces of absolute alcohol carries about a 10% chance of this syndrome. Among chronic alcoholics, the incidence of this syndrome occurring ranges from about 6 to 50%. So that's a pretty wide range of likelihood. So it's important to be aware that if you have alcohol when you're pregnant, it's not a done deal that this syndrome will develop. It's just interesting to note, high variety. Diagnosing this prenatally is difficult because the fetuses will oftentimes appear normal. Physicians don't always ask about the mother's alcohol use. A study was done in Minneapolis in which only 50% of physicians asked about the mother's alcohol use. Also, mothers are not always honest when asked this question, and the alcohol isn't screened for in the routine drug screens. So it's difficult to diagnose this prenatally. However, there are new developments in biomarkers that are working towards developing this prenatally. So these aren't fully established yet. They're very recent and new to science. So keep an eye and ear open for those if you're interested. The mental effects of the fetal alcohol syndrome could be easy distractibility, maladaptive behavior, microcephaly, skewed social perceptions, as well as an average IQ of about 68, so mental retardation. Here you can clearly see, this illustrates clearly how a brain's growth and development is retarded through alcohol. Liver abnormalities, cardiac defects, organ dysfunction, less developed fine motor skills, as well as the likelihood of developing epilepsy are linked to fetal alcohol syndrome. So fetal alcohol effect is another result, can be another result of a mother's use of alcohol. In this condition, it's basically not as severe as FAS, but still has most of the symptoms. So you can have only the birth complications, you can have only their neurodevelopmental disorders, or you could have bits and pieces of both that aren't necessarily as extreme as fetal alcohol syndrome. So both fetal alcohol syndrome and fetal alcohol affect children are more aggressive in class typically and are less socially competent. So here you can see the IQ range. Marijuana use during pregnancy. Because there are multiple studies that have such differing information about the consequences of using marijuana while a woman is pregnant, we will cover both the least extreme consequences found in studies as well as the highest extreme consequences found in studies to be as comprehensive and as accurate as possible. So here we go. We have a study which compared over 7,000 women who used marijuana, while they were pregnant, and there was no consistent link between prenatal marijuana exposure and birth defects or pregnancy complications when other factors in this study were controlled for. So absolutely no effect of this substance. And then a study done by the Johns Hopkins University found that there was a decreased gestational age, and a child's sleep patterns could be permanently affected. Also, among white women, there was an association with low birth weight, small-sized infant as well as preterm delivery, but non-white women didn't have these issues. Interesting to note. Also, the University of Washington conducted a study about the effects of cannabis on the development of the fetus, and lower birth weight, delayed commencement of breathing, poorer eyesight, tremors, poor ability to adapt to the environment, the newborns would spook very easily, and a likelihood of developing a hole in the heart is what this ventricular septal defect is, where was likely also increased risk of having that condition. So after 6 months, there was a higher likelihood of developing respiratory problems such as chronic wheezing, asthma, or chest infections. When these children reached the ages of 3 and 4, so toddlerhood, behavioral problems began to develop, as well as less developed motor skills, memory, verbal, and reasoning abilities were present in these children. Also, there are 2 particular types of leukemia as well as brain tumors that these children were more likely to develop than unexposed children. So here you go, you have cannabis affecting absolutely no consequences and then raising your risk of cancer. So just be aware of this discrepancy. Nicotine use during pregnancy. We find that nicotine use is associated with increased neonatal mortality, smaller head circumference, as well as lower birth weight. A study compared 25 women who were exposed to secondhand smoke, and they found that in comparison to unexposed women, there were about 158 genes in the placenta that were deregulated, with nicotine being the cause of this, and these genes were associated with blood clotting, the extracellular matrix, metabolism of lipids, stress response, apoptosis, as well as placental function. So gene deregulation as well as the complications mentioned above. Here you can see the use of cigarettes among pregnant women in about 2004 to 2005. Methamphetamine use during pregnancy. Linda Chang and her research team took MRIs of 29 children between the ages of 3 and 4 whose mothers had used meth while pregnant, and compared them to children who had not been exposed in utero. And the exposed children had about 4% lower diffusion of molecules in the white matter of their brains, and this is what Chang proposes as the reason for why this group reached developmental milestones later than the control. So there you have it, as well as Elizabeth Sowell comparing 21 children who had been exposed to meth and alcohol combined, comparing them to children who had only been exposed to alcohol, and the brain abnormalities were considered significantly more severe in the children whose mothers had used both alcohol and meth. So here you have mental developmental retardation. So cocaine use during pregnancy. Some studies show that about 15% of women in certain urban areas who are prepping for delivery have cocaine use. Interesting to be aware of this. When a mother uses cocaine, she increases her risk of heart attack, stroke, and sudden death, which in any event is going to kill the fetus. So women who use cocaine are associated with a higher likelihood of having preterm labor and delivery. The fetuses will be born early, spontaneous abortion and death. The average birth weight lowers, as well as the limb reduction in the infant is quite common. So here you can see an example of limb reduction. Also, a study was done in which 8-year-olds who had been exposed to cocaine prenatally were examined, and certain brain cells which allocated energy and as well as functions, as well as determined which could those cells that could function properly, there were deficits in those. So even after 8+ years of being exposed to cocaine, there were still consequences. Neonatal abstinence syndrome is an interesting thing to note because it can be caused by so many things. You have your amphetamines, you have your cocaine, you have your heroin. When the mother is exposed to addictive drugs while pregnant, the baby can develop this condition, and this condition, the babies will experience behaviors similar to withdrawal, such as tremors, irritability, and inability to suck, interestingly enough, which can hinder breastfeeding and can lead to malnourishment in certain situations. The best way to handle this is to put the child in an environment with little stimuli to calm the infant down, very peaceful. And after 7 months of age, there were no negative effects, which is really interesting to note. So it's important to be aware of all the effects and consequences that substances can have on a fetus, as well as later in life when that fetus has become older. So here is my bibliography. It's 3 slides long. I've attached it because it is pretty extensive. So thank you, and I hope you enjoyed this.